in session 5, Dr. Nicole Dowling.
Thank you. On behalf of the speakers of session 5 and as well as my co-moderator, Dr. Robert Carlson, it is my pleasure to give a very brief synopsis of the key takeaways and some recommendations from our excellent presentations. The focus of our session was the roles of federal agencies to advance progress in EHRs. And we heard from leaders from across the federal government, including the White House Office of Science and Technology Policy, CDC, the National Cancer Institute, FDA, the Office of the National Coordinator, and CMS. This slide shows some of the key takeaways from the presentations, and we've grouped them into sort of loosely into three buckets shown here. The first area of discussion was around the need to develop systems to extract structured data from unstructured EHR data. This point was noted by all the speakers and really has been a theme across these 2 days of presentations. This included the importance of developing and improving algorithms, which would include natural language processing and machine learning protocols, artificial intelligence, and allowing for the extraction of data across heterogeneous data sources. This was noted by multiple speakers in our session. This would have the result of improvement in linkages to source data in development and the use of checklists and templates to improve the collection as well as extraction of data, and standardizing real-world evidence and patient-reported outcomes data. A second bucket here was around the importance of enhancing functionality of EHRs for communication and collaboration, for patient care, as well as for research and surveillance. The speakers discussed efforts to improve interoperability of data as standards and networks, and to enhance standardized data sharing, as well as alignment of clinical decision support and communication. And third, we heard a good bit about the expanded use and requirements of certified EHRs, about the potential to improve interoperability, including between provider and patient, that certified EHRs are increasingly required for reimbursement programs and models, and include gradual implementation of patient-reported outcomes. Next slide, please. So this slide gives you an idea of some of the recommendations we heard from our very rich panel discussion. And these included the first here, which is to prioritize coordination across agencies, as well as with our state, tribal, local, and territorial partners, and with industry, academia, and other partners. And it was noted that the Office of Science Technology Policy was well poised to provide this coordination across these agencies, as well as significant leadership from ONC and others. So I think that the idea of improving and really prioritizing this coordination was loud and clear in our discussion. A second recommendation is to prioritize improved collection of the right information through the EHR, meaning the information that is needed and desired. And of particular note here is the right information to allow understanding of social determinants of health from electronic health record data, as well as shared decision making. A third point from the discussion was the need for continued gains in interoperability and standards, that this would be critical for improving clinical and public health decision making, patient care outcomes, and efficiencies. Another recommendation is for continued innovation in clinical decision support. The potential for hardwiring what are increasingly complex cancer screening guidelines into the EHRs is of particular importance and holds great promise for improving care, cancer screening uptake, and follow-up follow through, equitable health outcomes, timely and accurate surveillance, as well as research. And last, through improvements in EHRs, it is a top priority to explore and pursue opportunities for cancer surveillance and for public health, namely through, we heard about specifically targeting EHR components that are particularly difficult to extract and link information from, but of critical importance for surveillance and public health. And also to further leverage and develop linkages for source data for surveillance, which will increase potential for more complete, accurate, and up-to-date data. I think that's it for us, and I'll turn it back over to the moderator.
Thank you, Nicole. That was wonderful.